Hello everyone, it's me, Babs, your favorite sonographer. I am here in a hotel room in Orlando, Florida. I am attending an OBGYN conference. I've had some time, so I thought that I would set up my camera and make a quick video for you guys. First, I want to thank everyone who has been leaving comments in my videos and providing me with some information regarding ultrasound technology and also the career and school. Keep it coming. However, I don't know what to make of some of the other comments that people have left, because some of you are calling me names and saying that I'm in the wrong profession. I am not sorry for coming across the way that I do. If you were to know me personally, you would know that this is just how I talk. Don't watch me if you don't like how I come across, how I say things, what I say, because honestly, you don't really know me. If you knew how I was with my patients, you would know that I am professional and respectful. And believe it or not, get this, some of them actually really like me. Yeah. People actually do like me. But God forbid I'm honest and act like myself on my own channel. So for those who do not like who I am, what I'm saying, how I'm saying it, you're a lovely person. Moving on, I wanted to call this video Things That Rude Patients Do. But some of you might call me a bitch for saying that. Oh, wait, one of you have called me a bitch. So I've compiled a list of things that patients do that some people might consider rude or might consider gross, but I'm not going to say anything. I'm just gonna have you guys decide if you think it's rude or gross. How about that? First thing is coughing without covering your mouth. Now, believe it or not, I'm sitting here and someone would be on my right, laying down, facing up. We're still very close to each other. You may not be right here in front of my face, but when you cough, I get that. And I think, or someone might think it's gross or rude to cough without covering your mouth. The next thing that some patients do that others might consider rude, and it's not just patients, this is universal. Speaking a different language in front of someone who doesn't speak that language. Now, you could be saying God knows what. Most likely you're talking about the baby, but you can definitely get away with talking smack about the sonographer. Some people might find that rude. The only time that I think it's okay is if one of those people, either the patient or the patient's guest, does not speak English. So they're speaking to each other in their native language. But still, it's rude. Oh, I'm sorry. Some people might find it rude. Not greeting hello or responding when the sonographer says hello. I think that's pretty self-explanatory. Now, maybe they're feeling bad because some pregnant women do feel like crap. So maybe that's it. So I could give them a little bit of pass, but at the same time, some people might find it rude. The next thing that some people might find rude is being late. There are many different reasons for someone being late. And I'm not talking about the ones where they're stuck in traffic or things that are not in their control. And especially if the person calls ahead and tells them, look, I'm sorry, I'm running late. Or when they do come, they apologize for being late. The ones that I'm talking about mostly are repeat offenders and who never apologize. And some of them even are late and then they demand to be seen right away. Not only might some people find that rude, but they might find that bitchy behavior. Who knows? I'm not those people. I'm just saying. Leaving dirty used sheets on the sonographer's chair or really anywhere that is not on the exam table. Someone, not in my room, thankfully, but I have had people leave their dirty vagina sheets on my sonographer's chair, or just rather on my chair. But this particular person left her dirty sheets, used sheets that she wiped herself with, on the sonographer's desk, on top of the keyboard. That is nasty. Now, I don't care what some of you might think, how I might come across, but I'm gonna tell you right now, no matter where you're from, to leave dirty sheets that you use to wipe yourself clean when you've had a transvaginal ultrasound. Now that's what I'm talking about. This lady was a GYN patient, meaning she had a transvaginal ultrasound, and she put those sheets on top of the desk on the keyboard where we sonographers type and use our bare hands to type. I don't care where you're from. I don't care what you think I'm sounding like when I say this, but that is nasty and that is rude. That's disgusting. Okay? Moving on to the next one, because I have other stuff. Leaving a mess in the bathroom. If you're in a hospital in a small area and you go to the bathroom and you piss on the seat and then you don't wipe it so that the other patient coming right behind you or an employee coming right behind you has to wipe your piss. Now, it's not my piss, it's the other person's piss. Why do I have to clean it? Or there's tissue paper all over the floor. Some people might find that nasty and rude because this isn't a public restroom. Okay, you don't want to sit because you think it's nasty to sit on the toilet seat. That's your prerogative. However, if you decide to do that, it's your responsibility to wipe the seat if you piss on it. Next, patients who either just finished smoking or they bring a guest who just finished smoking. Now, either that's cigarettes or that's marijuana, and I've had both. Now, as a patient, there's nothing we can do about it if they come in smelling like marijuana or smelling like cigarettes. If you want to smoke during your pregnancy, I have nothing to say about that. But some people might think it's rude. Now, you probably haven't thought about this, but some people might find it rude that you bring someone in with you who just finished smoking, and not only does that person smell like whatever it is that they were smoking, but now the whole room smells like it. You haven't thought about that, have you? When you smoke, it sticks to you and people smell it. And then when you're in a small confined space, we smell it even more. And some people, like myself, start to get bothered by that stench. I inhale it, it bothers my throat, it bothers my eyes, and I can't stand it, and it bothers my nose. Why should I be subjected to that? I shouldn't be. Some people might find it rude. Okay, if kids are allowed in the exam rooms, in my place, thank God they're not, but if they are allowed, some people might find it rude if the patient allows the kid or kids to run amok. If you know that your kids are not well behaved when they're in a place where they should be well behaved, you shouldn't bring your kids, or at least try very hard to not bring your kids, because it could be rude when they're running around, when they're making noise, when they're touching things that they're not supposed to, because it's just making the sonographer's job harder. Just saying, some people might find that rude. This next thing, some people might think it's rude, some people might not, but this is also universal. When a patient asks the technician if they have kids, and if the technician or anybody in general says no, the person says, oh, why not? Or, oh, you still have time to change your mind, if the answer is that they don't want kids. That's a whole topic in it of itself. That's something like really major. first, what if they have been trying to have kids and they can't? What if they really don't want kids and they've made that decision and it's final? It's kind of rude and presumptuous, did I say that word right? To think that, first of all, everybody wants kids and that this person just hasn't found the right person to have kids. But don't worry, you're gonna want kids and you're gonna have kids. You still have time. Like, who are you? Now, that doesn't really apply to me because I have a child and so it's okay, but I can see the other side of it, especially if someone has been trying and they can't, and then you're talking about it, and what if they don't want to talk about it? What if they don't want to tell you their reason because it's private and you're bringing it up and you're hurting them by bringing up that topic? Like, you just don't know what someone else is going through. And if someone just doesn't want to have kids, flat out don't want kids, the fact that you're bringing it up, they probably heard it a lot of times from their friends or their family, and they just don't want to hear it from you too. You know, that's not fair. Like, they hear it from their family all of the time. Like, why don't you have a boyfriend? You should get married. You're getting old. You're not getting any younger. Go do IVF. Go do IUI, artificial insemination. It's like they don't want to hear it. They don't want to go to work and hear it from the patient. And I know you want to connect with the person. If you are a patient asking the other person if they have kids or if they want kids, I know you want to connect because, you know, you're pregnant and this is what it's all about. Kids, right? Babies. But at the same time, just be mindful, especially if they say that they don't have kids and then they don't go on and on about wanting kids. Like, and they just say, no, I don't have kids. Just, you know, maybe don't push the topic because you don't know what's going on with them. If you are a patient and you've done one of these things, you are forgiven. It's okay, we all make mistakes. Some people might have found it rude that you did that. Some people might not have, but it's also something to be aware of. Maybe you didn't realize that what you were doing or what you said or whatever was rude. Who knows? Just be more mindful of what you say and what you do. That's something that I try to do every single day of my life, especially when I am at work and I am speaking to a patient. I try to be aware of my tone and how I come across, and I try, not all the time because I am human, I try to put myself in the patient's shoes, and how I come across can really impact their experience. My second channel is up and running. Please check it out. It is Babs a Baddie because I am a baddie. You take it however you want to take it by that title. But I have a video all about how my ex threatened to kill himself if I left him. Now, for those of you who have not seen the original video in this channel, go ahead and just check out that video first. And for entertainment purposes, if you want, check out the original video so you can see the difference. It's a big one. Anyway, I really appreciate your support and your comments and thumbs up, and whatever you want to give me, I'll take it. Even the haters provide engagement. Ciao!